I will give you a short background on the situation and the network. And then we have said that each of the speakers have around 10 minutes to discuss their own country cases and what's going on with vaccination in their countries. And then we'll have a good chunk of time for the Q&A session. And I think our hope is really that you will be participating actively in this. And I think also the panelists will be able to ask each other questions from what's going on in the respective countries. So again, with that, we can move on to the next slide. Thank you. So I'll have, as I said, a short introduction of the network, and then we'll move down the list as discussed. So we can take the next slide, please. Just for those that are new to the free network, it's a joint effort from the institutes you can see on the screen here. I'm at the Stockholm Institute of Transition Economics. And what you see on the left is basically how our logotype was developed back in the days when we created this logotype, or when our consultant created it. And basically mapping out sort of the different network nodes on this chart. So we are also going to use this order when we present the different country strategies. And to sort of those of you that have an interest following what's going on in this region, I would strongly encourage you to take a look at the freepolicybriefs.org website that we produce together in the network. A lot of interesting policy briefs on questions that are relevant for this region and also on the global scale. As you can see here, the latest brief was basically on how mobile broadband internet has affected politics around the globe. Very topical and interesting read for sure. But you can find a lot of different subjects here. So please, if you're interested, all of this is free, so you can download briefs that are 3 or 4 pages long, basically on interesting issues in this region. Okay. Today, I'm very happy that I will not be doing most of the talking. I have with me Jesper Roine, who is a professor here at the Stockholm Institute of Transition Economics. We then have Natalya Volchkova from NES and Zephyr in Moscow, Lev Lvovskiy from Becker in Minsk, Iurii Ganychenko from Kyiv School of Economics in Ukraine, together with Pavlo Kovtoniuk, also from Ukraine. We then have Yaroslava Babych from ISET in Tbilisi, Georgia, Michal Myck from Senea in Poland, and I'm hesitant to saying exactly what city, because Stettin is not something I can pronounce properly. And then we have Sergej Gubin from Biceps in Latvia, Riga. All right, so that is going to be our lineup today. I will then just briefly give you a little bit of looking back to what's going on with the COVID-19 pandemic in our region before we hand over to the separate country cases. So if we start with this slide, on your left, the left panel is from April. And what you can see on the map is basically how many confirmed COVID cases or infections we have in different countries around this part of the world. And what is important with this first chart is that you can see a lot of the countries in Eastern Europe were relatively spared from the initial phases of COVID infections. So this was actually creating a big discussion about the East and West divide and the sort of Iron Curtain of COVID back at that stage. But unfortunately, as we see time evolves in this map going through October and then now at the end of January, of course, every country have more infected on a cumulative basis at this stage, but we can also see that the eastern parts and Central and Eastern Europe have been very severely hit also by this COVID pandemic by now. So these are the infection rates. If we turn to death rates, again, a similar map, of course, that you had very few death rates to the east initially. And also in the middle of the crisis, still in October, you see it's very light shading in Eastern Europe compared to countries in Western Europe. We are sitting up here in Sweden, and of course, Sweden had quite dramatic numbers of deaths, and Jesper will go into those details. But unfortunately, as we also now see at the end of January, quite a few of the countries in Eastern Europe have very significant numbers of people dying from or with COVID-19. I mean, we have to remind ourselves about one thing, of course, in all of this, that statistics is only as good as the numbers that are being collected. And of course, the numbers being collected in turn, when it comes to infection rates, is a function of how many people are tested and how well the authorities organize large-scale testing. So, I mean, we need to keep that in mind, but still, these are the numbers that we have available to discuss these issues. So these are the cumulative number. Now, if we turn to what is actually going on right now as we know it, what you have in this chart is the sort of daily new confirmed cases of COVID-19, and this is a 7-day rolling average, and it's per million people. So we adjust for how many people live in the countries, of course. Again, we can see that, you know, some of the countries to the east are a little bit less affected than the countries in west and up here in Sweden. Sweden is, of course, an outlier when we are compared to Norway and Finland, but less of an outlier if we're comparing ourselves to France or Britain or Spain, etc. But again, we are far from over this pandemic, which of course makes it even more important to discuss vaccination efforts. And I think this is certainly going to be a very defining time period for all of us. How and when can we get vaccinated? All right, so this is giving you the basic background. If we then actually move over to today's topic, which are these vaccination efforts in free network countries. Just as an introduction to this, first of all, you can see, if you have good eyes at least, to the left, this is the share of the population that has received at least one of potentially 2 doses, depending on exactly what vaccine. And we can see there that Poland is sort of 4.5 to 5% of the population. Sweden is approaching 4% of the population. Latvia is barely at 2%, and Russia is lagging with its data, but it was less than 1% mid-January, and we'll listen in with Natalya to see how this has been developed. But you know, we can also put this in a more global perspective, and of course, we all know by now that Israel has been extremely successful in getting sort of big shares of the vaccine delivered to Israel and vaccinating almost 70% of the population now. So that's sort of the world record as we know it right now. But again, this is certainly a very important topic, and it will create a lot of discussions around the world and in this region. So with this, I'm now going to hand over to our country experts, and I would like to start with Jesper. Jesper, please, you're on for Sweden. Thank you.
Okay, thanks a lot, Torbjörn. Can you hear me okay? I don't see myself on the screen, but hopefully that's fine. Okay, so given that this seminar is a bit of a follow-up on an event we had in late May, I just wanted to sort of recap what the situation was like there then, rather. So Sweden famously early on became known for standing out in terms of both the chosen strategy, some would say lack of strategy, and also in terms of having very high death rates compared to especially the neighboring Nordic countries. So this created a lot of debate early on, but it's pretty clear that the strategy chosen quite early, like early March, was to limit the spread so as to protect hospitals from being overwhelmed, but certainly not sort of trying to stop the disease by tracing and having a lot of testing early on, but rather to have a strategy which limits the spread, but then to protect the elderly from disease. This failed, especially in terms of protecting the elderly, with the result that a lot more people died in Sweden in these groups than in neighboring Nordic countries. This, of course, created a lot of discussion about whether Sweden's strategy, in fact, was doing nothing. That was not the case. What was the case was that Sweden relied heavily on recommendations. So no real lockdowns in the sense as in other countries, but instead a reliance on recommendations. These recommendations did have effects, but very small compared to, again, the other Nordic countries. But much of the discussion since has been what is the right benchmark, because as Torbjörn mentioned, Sweden has done equally poorly as many other European countries, but much worse than other Nordics. And then the question is, those defending the Swedish strategy would say that we're doing about average, and those very critical would say that that's not the right benchmark. The benchmark should be the other Nordic countries. So the situation right now is that the number of cases started to pick up again in November. From my point of view, due to having pretty lax attitudes early on and only sort of introducing stronger recommendations about being careful when the spread was back again in society. So starting November, the number of cases and with those deaths have increased again. The chart here on the side, on the right side, shows you a bunch of different lines for death rates, number of people in intensive care, number of people being hospitalized due to COVID, and number of people above the age of 70 that get COVID. And all of these show pretty similar patterns. And today, currently, the situation is that from about 4,500 dead in May, we now stand above 12,000, which is about the European average, but much, much higher than the other Nordic countries. And currently, the worry is a third wave. Not sure that it should be called a third wave, given that we're not down from the second one yet, but and the major issues here are, of course, the new virus mutations spreading and upcoming vacations. And once again, there's no plans to sort of shut anything down, but instead to increase sort of recommendations about being cautious. So that's the situation as it stands right now in Sweden. In terms of the vaccination status, the current situation is, again, as Torbjörn pointed out, we're close to 4% of the population having gotten dose 1, just above 1% have gotten 2 doses. The vaccines available are the Pfizer-BioNTech, Moderna, and AstraZeneca. So far, mainly Pfizer-BioNTech has been distributed and delivered. Of course, Sweden, being part of the EU, is part of that coordinated effort to buy and secure vaccines, but this has, of course, run into problems, as most of you know. So the current discussion is very much who's to blame for this. Is it a sort of failure on the European Union part, or is it failure on the national level in Sweden, or indeed is it a failure in terms of distributing the vaccines? And this is something I'll mention a bit more about. But in general, in terms of the situation in Sweden, the overall attitude in the population is that the public is relatively positive to vaccines. So if you ask people, more than 80% will say that they for sure will take the vaccine when offered. Only 6% say no. There are some interesting differences here across political affiliation. In particular, those who say they vote for the Sweden Democrats, which is the nationalist party in Sweden, only 60% of them say that they will take the vaccine if offered. And this, of course, correlates with those voters in general having lower regard for central authorities or politicians in general, so less trust in institutions, basically. In terms of the plans and in terms of how this is structured in Sweden, the delivery, the responsibility for delivery to Sweden and the planning and also some of the information campaigns, these are centralized, again, with the Public Health Agency being sort of the responsible for the implementation here. But then the actual vaccination, as healthcare in general in Sweden, is at the regional level. So this, of course, creates a bit of issues in terms of how exactly this should be done. So early on, the Public Health Agency developed recommendations for the priority order. And these were then challenged by regions that said that we have reasons to do it differently. And again, since the Public Health Agency does not have a mandate to sort of order anything, they only give recommendations and guidelines. This has led to a bit of a difference in terms of implementations. In some cases, I think for the right reasons, for good reasons, but also it gives a lot of leeway to individual actors regionally to basically divert from the national recommendations and do something different. And this, of course, makes it difficult to assess exactly on what basis are vaccines distributed. There has been some cases also with the corruption, sort of the management of hospitals getting vaccines before others, etc. So, but overall, the sort of structural issue is really about who's at fault in terms of being responsible for the slow vaccination pace. And for sure, my picture would be that absolutely the delivery of vaccines is an issue, but it's also the case that there's big regional differences. So the little figures on the left here, left bottom, first of all, one shows the age distribution of vaccinated people so far. So the priority wave, the first wave, includes elderly people, and in particular older people in elderly care homes, but also personnel in healthcare and elderly care. So this is pretty clear from the picture that so far a little more than half of the doses have actually been distributed to people below the age of 70. So half of the vaccines nationally have gone to old people. So one can only hope that all of the rest there are indeed people who work in hospitals, and for those reasons have good reasons to have priority to get vaccines. The bars show the ratio of delivered vaccines, distributed vaccines over delivered vaccines across regions. So this also shows that in the regions that have the slowest pace, only about a third of vaccines delivered to that region have in fact been distributed, and all the way up to some regions even distributing more than what has been delivered, which makes one wonder a little bit about the precision in these statistics. But you still see big regional differences here. And so I think as often the problems here lie in both the delivery, but also in terms of implementation in the regions. So I think I'll leave it at that for now, and then we can discuss more issues when the others have presented their country situation. So I'll leave it to Natasha.
Thank you, Torbjörn and Jesper, for delivering very detailed information on situation in Sweden. I will follow this pattern and we'll discuss situation in Russia. So it's not in terms of distribution of, in terms of dynamics of active cases. It's not a big difference from situation in Sweden. So the second wave, that's how we call it, it started in early fall in Russia. After and its second wave, the maximum of active cases was 3 times bigger than in spring. So it's more or less the same as in many other countries. So the facilities, hospital facilities that were discharged in summer, during summer, they were put in force back in fall, and at maximum active in winter, start in December, the number of there was no deficit of hospital beds to meet the demand on part of the population. So that was the good news. Current news is that around the middle of December, in the close to the end of December, actually, it's around Christmas, December 25th, it was the maximum number of active cases in Russia, which after that turned down, and currently the number of active cases, daily number of active cases, correspond to the situation in the middle of October. So it is on the way down. There is potentially that we still are. Russia still in Russia new types of COVID that was called British or African one is not yet circulated to full extent, so it might be that after it's will be distributed in Russia, it will be again the surge in active cases, but we'll see. So that's the number of deaths was recently announced by Rosstat, the updated number relative to the information from which was not very precise. So Rosstat updated information is now the number is 160,000 deaths in 2020 from April to December of 2020, which are attributed to COVID, either as a first major reason or a secondary reason of death. And besides, there are similar amount of extra deaths relative to the normal situation, which Rosstat does not attribute to COVID, and it's big still question. It requires further research, further investigation of what are these death related to. So there is some information which need to be updated and specified. So as far as vaccination situation is concerned in Russia, the Russian vaccine, which is the formal name is Gam COVID Vac, and in it's more, has another popular name, Sputnik V. It was registered in August, and a limited vaccination mass limited means that it was limited to some criteria. It started on December 5th in Moscow. It started with being delivered to people above 18 years old and below 60. So the elder people were not first the targeted group of this vaccination, of this limited vaccination. It was for younger people and based on professional priorities. It was military, medical professionals, teachers, and social workers. In a few weeks, it's extended to more professional groups such as personal services and some others. And in January, starting from January 18, it is extended for people above 60. That is, there is no age limit, only from the below. So it's person should be above age 18, and no professional limitations as of January 18. So anyone in the above 18 might be vaccinated. As of February, unfortunately, there is no collection, daily collection of information on number of vaccinated people, which is available publicly. So I failed to find this information. The only recent information we know about the doses of vaccine that was produced and delivered to hospitals, to stations, to vaccination stations. So it's 8.6 million doses as of 2 days ago that were produced, and 5.3 million delivered already. So the approximate information that it is now more than 1 million people that are vaccinated, and it's still a rough number without indication of how many people received 1 or 2 doses. But generally it is around 1% of population above age 18. And as far as the process is concerned, so it is available to anyone, no limitation. You need to show your passport, and because information is registered then so in the system about this person, and by the way, it might be even foreign passport. It's not necessarily Russian, though it's available for people, and you can use the electronic system, which is state electronic system, which where people get various electronic services. There is the service there which allows you to register to sign for vaccination for exact period of time. Just so there is a joke now that because the vaccine is distributed in the amount that it requires 5 people to be vaccinated simultaneously, because it's 5 doses in one tube. So it's people go to hospitals, to medical facilities, and they're waiting for 5 people to be together in order for the doctors to open this tube bottle and give the vaccine. Otherwise, it will be thrown. The stuff that will not be used will be thrown away. So it's free for anyone now in Russia, not only in Moscow. It started in Moscow, and now it is across the country. Of course, it's more difficult for far places, for places without good infrastructure. So, but it's possible to get vaccinated anywhere. So it's the expectations. So the production of vaccine is facilitated by Russian fund of direct investment, which ensures the production process and distribution. And according to this fund, the up to July, all Russian population that is willing to be vaccinated will get the vaccine. So waiting time currently to get vaccine, if you want, is less than 1 week. There is also option to get vaccine without registration in this electronic system in mobile stations. So in Moscow, it's available in shopping malls. In few shopping malls, you can go and be vaccinated. So there is no expectation that foreign vaccines will be available in Russia soon. So some people in Russia, in different polls, there were a number of polls where attitudes of people about vaccine were analyzed, and 50-70% in various surveys. But I'm skeptical about how representative they are. They indicate that they are fine with having vaccination. But some part of this respondents, they are waiting for another two vaccines that Russian institutions are producing or expected to be in market: Epivac, Roine, and Chumakov Institute. So that's I believe is that the willingness of population to get vaccinated, that is the main restriction currently, and it will be the main restrictions in medium term, and because not everyone wants to be vaccinated, and there is some hesitance on part of population. So, but being a teacher in the university, almost all of my colleagues are vaccinated, and we started offline teaching this week. So that's in Moscow. There was the teaching in universities was online till this week, and started opening for offline teaching this week. So we'll see how it will turn out. And schools, secondary schools, were open for offline teaching a few weeks ago. Thank you.
Well, hello everybody. Now let me talk a little bit about Belarus. Let's start with some history. In the beginning of the pandemic, Belarus was doing relatively well. The spread of the disease here started later than in most European countries. In Belarus, with its around 10 million inhabitants, official numbers of cases were pretty small in the beginning. Then they reached about 900, 950 cases per day in the end of April. And the official death toll was beyond reasonable doubt, non-realistic from the beginning. So just from the variation analysis, official stable numbers of 4, 5, 6 deaths per day were very non-realistic by that time. Later, we had some calm down in summer, and now we are, as most of other countries, in the middle of the second wave. Official numbers of new daily cases nowadays are about 17-20 per day. Official death toll is still pretty low. So by official numbers, we have around 1,800 deaths related to COVID. Through the whole period, we don't have good, trustworthy, up-to-date statistics on the actual death data. From few sources that we have, the excess mortality is about 14 to 20%. The last full trustworthy full death data for the country was recorded in July, and by that time we had around 5,600 additional deaths relative to the similar periods in previous years. Now let's talk about vaccinations. Again, we don't have any precise specific data. What we have is some rare media interviews by the officials. Right now, government reported that we have imported about 20,000 doses of vaccine from Russia, Sputnik V vaccines, and they, as of now, they mainly go to medical professionals. Additional 100 to 120 doses were promised by Russia. So in total, different sources say it should be either 120 or 140,000 doses from Russia, but right now we only have 20,000. There was a telephone call between Alexander Lukashenko and Xi Jinping of China. And after that call, it was reported that China promised some vaccines, but no details were announced. As of public opinion about vaccination and individual plans, we don't have any national polls. But from what we know, the public opinion is somewhat mixed with regards to desire to be vaccinated or not. Let's go to vaccination plans. So with these 140,000 doses from Russia, the plan is that first they will be offered to medical professionals, and if take-up rate among them will be low enough, some educators and teachers will be vaccinated too. By late March, government promised to open production of Russian vaccine Sputnik V in Belarus, but no precise plans or details were also announced. The plan is to first vaccinate medical professionals, then educators, trade personnel. Further plans are not detailed again. So basically I have not many things to say, because most of plans that we have are just some abrupt half words that we hear from politicians, and no statewide campaign. Government is not taking COVID too serious from the beginning. In the very beginning of pandemic, we didn't have any lockdowns or special measures. Recently, government started to ask people to wear masks. And if we will go to the next slide, this is a picture taken today on the Belarus National Assembly. So as you can see, government is still not taking COVID too serious. So I guess only future will show us what will happen. Thank you. And let's go to Ukraine.
Thank you very much, Lev. Very interesting picture. And situation in Ukraine is the opposite one. Yes, everyone wears masks in public places, and social distancing is quite strong also. And I will cover the current and previous situation as for Ukraine, and then I will pass the floor to Pavlo to talk about vaccination status and further plans. If to talk about the previous situation in May, we avoided completely the first wave of the COVID-19 spread. And it was due to the strong lockdown that was entered in the very beginning of March 2020. And we see that the situation there in May was very mild, meaning that the number of cases and deaths was quite low, at a low level. And the government at that time approached the approach actually that was proactive, meaning that the government was focused on the strong measures just to protect, just to prevent the further spread of the disease in Ukraine. And this approach changed in the early August, and the indicators to enter or ease restrictions were completely changed, and they were changed from the dynamical ones that were focused on the prevention of the spread to static ones that were just reactive, not proactive but reactive. And Kyiv School of Economics estimated the total number of deaths till the end of the year at the level of up to 10,000 people. But with the change of the approach and with the change in seasonality, we got up to 20,000 deaths in Ukraine at the end of the year. So plus 10,000 deaths actually versus our first forecast, but we changed actually the forecast back in October when we saw already 5,000 deaths, and we saw these changes in the governmental approach. And actually we projected at that time in October that till the end of the year we would have the amount that is close to 20,000 people. And actually this scenario was realized. And what we have at the moment, we have the number of deaths at the level of almost 24,000. And we observe the constant decrease in the number of cases started from the late November. And just to compare, the number of cases dropped in 3 times. So we had about 12,000 in November and 4,000 in February right now. And it's not due to the fact that COVID disappears or there is a lowering in the spread of the disease, but it's because it's mostly caused by the fact that the detection rate is shrinking. So the detection is less and less on a daily basis, actually. And that is why we see this strange situation that we have many cases that are actually done, meaning that they discharge from the hospital, but too low cases that are new, and it's because the fact that the detection rate is small. And the actual situation in Ukraine is quite challenging right now, and it's stable. So if to talk about the number of admissions to the hospital, it's corresponds to the number of discharges. And this means that the occupancy rate for different kind of resources, meaning the beds with oxygen or the beds in ICU, they remain stable, and the bottleneck in the system is the beds in intensive care units in ICU, and the occupancy rate is at the moment at the level of 40%, and it is on the same level. And we see new outbreaks in Ukraine. They are in the west part of Ukraine, and we have 3 regions that shows the increasing dynamics of the number of hospitalized cases, and the burden on the healthcare system is growing there. And the future situation depends on several factors. The first one, whether Ukraine can handle this situation, meaning to stop these 3 outbreaks on the regional level. The second one is the external threat, meaning that there are different variants of the virus that might come to Ukraine. And the third one is how the vaccination will proceed, and about the status of vaccination and further plans we'll talk Pavlo. So Pavlo, the floor is yours.
Thank you, Iurii. Now getting to the vaccination status in Ukraine. The status is that our country has not started its campaign yet. We were unfortunately quite late with starting the negotiations and contracting processes for vaccines. And that started only in December. So currently we are only at the very beginning of that road. There is no shipments right now in the country, but the contracts are beginning to emerge, luckily. The first contract was the small contract for the Chinese Sinovac vaccine, of 1.9 million doses, which is quite small number for our country. And quite recently, we got the news the government had a deal with the Serum Institute of India for AstraZeneca and Novavax vaccines in the amount of 12 million of doses, which is already more or less a substantial number. And all in all, it will allow to cover kind of around 7 million of population, which is again not that much, but at least it will allow Ukraine to start its campaign. Also, there is an agreement with the COVAX initiative, which Ukraine is a participant of. And under this initiative, we expect to have 8 million of doses sometime this year. We don't know when, but hopefully the earlier the better. Also, we are expecting very soon of arrival of 100,000 vaccines of Pfizer. That would be used immediately for the inoculation of medical professionals, because we don't really have the infrastructure for keeping them. So that would be again a small but still already start of the campaign. Speaking of the population readiness, we have quite a mixed data. Actually, I'm aware of two major polls happened in the country since December. One actually was in December and it showed 39% of the general population ready to be vaccinated. A little bit higher number was among the group of 60 plus, which is good news. And the poll in February said that this number is now 62%. However, the agencies were different, the methodologies were different, so I don't know whether we can say that these numbers are comparable. So we are waiting for probably another polling on that. However, all in all, both numbers are quite low, and that means that the demand is still not that high to have the full-scale and fast campaign. Interesting fact is that most of the people trust most EU and US manufactured vaccines. In December, it was kind of 20 to 30% of the respondents. And the trust for Russian, Chinese, and Indian vaccines is low, especially for Chinese vaccine, which we have the contract for in Ukraine. And the other important fact is that Russian vaccines are banned in Ukraine for the obvious reasons, I think. And this is the decision of our parliament from the last week. Now, speaking of the plan, the government plan is quite modest. It says about 20 million of population to be covered over 2021, 2022, whatever it means. There is no actual detailed timeline in the plan, just years. And that only means that the priority groups will be covered, which all in all comprise about 50% of the population. Nothing is said about the general population to be covered, and actually we assume that it will happen after the old priority groups will be there. Speaking of priority groups, it's the same story as in most of the countries, and actually the colleagues were mentioning all of it. The ladder of the age-related risk group, starting from the oldest to the like from the 80 years to 70 to 60, and then medical professionals, military and frontline workers, and etc. Interestingly, the distribution channels for vaccinations are quite conservative in our plan. They are going to be administered via mobile units serving the kind of professional groups, for example, medical professionals or military, and the general primary care network to cover the rest of the priority groups, which raises concerns about actually the volumes which it can produce, because the regular vaccinations are also should not be forget, of course. Speaking of the registration for it, again, the plan says only about priority groups. And the assumption in the plan is that the vaccine availability is a major bottleneck. But I would add, and actually this is what our school had proposed to the government, that we also should think of the low demand from the population and the ability of the infrastructure to administer vaccines when they are in place. And actually we proposed a little bit, how to say, decentralized approach to that, allowing also private facilities and non-medical facilities to be involved into the network of vaccines administration. On that point, thank you, and over to Yaroslava.
Thank you very much, Pavlo. I'm very happy to present the view from Georgia. As you know, Georgia was one of the, in May 2020, was one of those few countries in the world which by timely and forceful intervention actually managed to contain the first wave of coronavirus, the first wave of pandemic. But then, as the summer started rolling in and the restrictions on international travel and domestic travel were being lifted, the country was caught by the second wave of the pandemic, and this wave was pretty massive. So in the peak of the second wave, which was in December, around 4,700 new daily cases were recorded for a country of 3.7 million people. So essentially more than 1,000 cases per million, and this is one of the highest rates in Europe. So Georgia had a problem in the second wave, but as the economy, and of course the government imposed strict measures starting from November. So no public transport was operating, schools, universities were closed, people were fined for not wearing masks, even in the open spaces. A curfew was reimposed from 9 p.m. to 5 a.m. And so on. So a lot of retail trade outlets have shut down. Only shops, only food stores were allowed to operate. But then again, the economy of Georgia heavily depends on tourism and retail. So tourism, for example, accounts for around 14% of GDP in 2019. Many people depend on tourism-related industries for their livelihood. So opening up the economy is quite urgent for Georgia. The retail traders, restaurants are all eager to open up. But of course, there is a fear of the third wave that is being predicted to start as early as the end of February, essentially, right after these restrictions are being lifted. And Georgia cannot rely on herd immunity. Although many people have had COVID by now, official statistics says that only 7% of the population have had COVID so far. But unofficially, of course, the number may be higher. And if we rely on European estimates that for every person who has had for every registered COVID case, there may be 3 or 4 unregistered COVID cases. This percentage goes up to 20-25% of the population. But still, this percentage is not enough for the herd immunity to kick in. And so the fears of the third wave are quite substantiated. So what is the vaccination status of the country? Just like in Ukraine, the campaign has not started yet, but the public plan is already available. And we have secured supplies, although not through the direct contact with vaccine suppliers. Georgia does not have direct contact with any of the vaccine suppliers, but it is supposed to get the vaccine shipments through the COVAX platform, like so many other countries. So the country has already ordered 1.4 million doses, enough to vaccinate about 20% of the population. And the way the COVAX platform works is that, once the country gets these doses, it would have to wait until all the countries who are part of this platform have had their shipments, that would cover at least 20% of their population. So in this, Georgia would depend on the efficiency of vaccine production and on the rate with which other countries in the COVAX platform receive these shipments. So first 29,250 doses of Pfizer-BioNTech vaccine are supposed to arrive in Georgia in February, late February. So these vaccines, of course, would have to be stored in special conditions, and only 3 major cities would be able to handle these vaccinations. So 10 hospitals would be the sites of vaccinations, and in the first stage, of course, only the medical personnel would receive these doses, and people in long-term care facilities. So the plan is similar to what other countries are proposing as well. The plan for the country is that 60% of the population would be vaccinated in 2021. But this seems to be too optimistic, overly optimistic, for several reasons. And reason number one is the possible delays in vaccine shipments through the COVAX platform. Essentially, the studies that have been done internationally indicate that vaccines in countries like Georgia, widespread vaccination may not start until late 2022. So this was the economists that published the forecast based on their estimates. So the second constraint is the limited capacity for Pfizer and Moderna type vaccines, which need special storage conditions. It's not as prominent as the first reason I mentioned, but still Georgia right now has capacity for about 200,000 doses of Pfizer type vaccines, enough to vaccinate around 7% of the population. In the last place, I would say, is the public trust in the vaccine, although it is pretty low, or willingness, let's say willingness to take the vaccine. Only 41% of the population say they would take the vaccine if it were available. About the same percentage, 41% would not vaccinate, and 17% don't know. But these attitudes are shifting slightly in favor of the vaccination. So, for example, in June, so these numbers were from December 2020. In June 2020, the percentage of people who would not vaccinate was 46%. So this was, there is a slight improvement. The public is more trusting vaccines that are currently available through COVAX platform, but according to some surveys, they are particularly mistrustful of the vaccines that are originating in China and in Russia. So, and the reason stated is that people do not trust the clinical trials data that are coming from these vaccines. So I would say that this public trust is an issue, but it may become less of an issue once people start getting vaccinated, and once there is these fears of side effects are subsiding. In the same time, we can say that there is perhaps a misinformation, whether it is a concentrated campaign for misinformation or it is just rumors that are circulating. But CRC public opinion conducted public opinion polls and has detected a significant level of misinformation among the public about vaccines in general, not just the COVID vaccine. So these, I would say, are challenges, and I now turn the floor over to Michal in Poland.
Thank you very much, Jasia, and thanks to everyone else before. And greetings from Szczecin, from Poland. Brief update on what happened early on in 2020 and what's happening now to start with. Poland, like many other countries in the region, entered into very severe lockdown early on in March and April. And as a result, the number of infections, the number of cases in Poland in the spring and early summer was relatively low, and also the number of COVID-related deaths in the spring was pretty low. However, we've never really ended the first wave, so to speak. The numbers never went down to single digit or double digit in terms of the daily cases. For a long period, the daily cases were about 300 to 500. And this is the situation with which we entered the summer season, when the situation in terms of lockdown got quite strongly relaxed, which was followed in the autumn by very rapid increases in the number of cases, and we had a pretty severe crisis, I could say, one could say, in October, November, and December. In late November, the average the weekly rate per day was about 25,000 cases, and the number of deaths per day also quite quickly increased in that period. The highest number of daily deaths was 674, and that was on the 25th of November. The numbers have fallen, the number of cases has fallen again, and now it is about 3,000 to 6,000 per day. However, Poland is testing a very low number of individuals. Our number of tests has always been much lower than other countries in the European Union. So if we compare the number of cases per day and the number of deaths per day, which still are pretty high, the numbers suggest that clearly the number of actual cases is much higher than that officially reported. We currently have between 200 and 300 deaths per day, so the situation is still very severe. What was particularly shocking is not so much only the number of COVID-related deaths, but also the total excess deaths that was reported at the end of the year, which the statistical office showed relative to the expected number of deaths produced in the forecast before the pandemic. And relative to that, the number of total deaths per year last year was over 60,000 higher than expected. So that really is the toll of the pandemic in 2020. With respect to vaccinations, Poland is of course part of the EU coordinated effort to purchase and distribute vaccines. The vaccination program started in late December, and by now about just below 2 million doses of the vaccines have been administered. This is still low, but compared to several other countries that we've heard about, actually not so bad. Currently, about 70,000 vaccine doses are administered per day. So, if things continue at this pace, we will have to wait for a long time before we reach population immunity. The government announced the national vaccination plan. It has several stages, and the stage 0 is behind us now. It focused on the medical personnel, people working in hospitals and treating patients. The second stage, stage 1, is now in place, and it started with, it was rolled out according to the age of individuals, started with people aged 80 plus. We are now in the state where people aged 70 plus are beginning to receive their vaccines. It will continue to those aged 60 plus, and in parallel to that, the process of vaccinating teachers is starting, and also the military and police will be vaccinated in stage 1. Later on, further groups of the population will receive their vaccines, and we are hoping to cover the entire population by the end of the year. Registration and the entire plan is pretty well organized, of course, with some hiccups, but so far has been going relatively smoothly. What will be the limiting factor in terms of vaccination in Poland will be, on the one hand, the number of doses available, and that has been raised as a significant challenge. And on the other hand, as mentioned earlier in the case of some other countries, the attitude and approach towards vaccination. In Poland, there was a poll in December which suggested that only about half of the population are willing to get vaccinated. Perhaps with the campaign going on and the discussion of the advantages of the vaccines and perhaps further evidence that they are safe, will convince more people to get vaccinated, but that certainly will be a challenge in Poland as in several other countries. So the situation, so the pandemic situation is still very severe in Poland. We have very high numbers of deaths, and the number of tests continue to be low, but the vaccinations, of course, offer hope, both from the health perspective, but also from the perspective of generally opening up the economy and coming back to the more social interactions and more normal social life as well. Thank you very much. I'll now pass on to Sergej in Riga. Thanks.
Yeah, thank you, Michal. Hello from Latvia. Let me report on the situation here. Let me first remind what was happening in May 2020. Like many other Eastern European countries, we were rather successful in dealing with the situation with the COVID. There were very tough measures implemented, closed airport, borders, school, universities, there was a large mobility drop, so people actually followed the recommendations of the government, and there were no masks though, and no curfew. Situation now in February is quite strikingly different. So you can see on the graph on top right, we are essentially in the middle of the second wave still. There's well, some might call it a plateau, something that we have night curfews from 10 in the evening to 5 in the morning on nights from Friday to Saturday and from Saturday to Sunday. Non-essential shops, schools, universities are closed, 2-meter distancing, and we have compulsory masks indoors. The number of tests is very substantial, I would say. Number of infected and diseased, so you can read it on the graph. And now turning to vaccination status, we are part of the European Union, of course, so we do have access to Pfizer, Moderna, AstraZeneca, and currently it's available to medical staff. So country faces in practice 2 types of constraints. One is availability of vaccine and another is the capacity to administer vaccine. And at the beginning, so in the very beginning of January, the end of December, unfortunately, the second bottleneck was prevailing. So we didn't have capacity to administer what we had. So the graph on your left shows, the blue line shows the total number of potential vaccinees, what can potentially be administered, and this orange bars, it's like actual shots. And so at the very beginning, even though we had very little of those vaccines, just 5,000 of Pfizer doses, we couldn't administer them. And that was part of the reason, essentially the main reason why the health minister was fired at the very early in January, exactly because of this slow vaccination process. Now, at the moment, we are reaching the capacity, so we are reaching the total potential number of vaccinees. So the second bottleneck is, so the first bottleneck, sorry, is prevailing availability of vaccine is the main issue. There was a poll about the attitudes towards vaccination. Approximately 50% of population is ready to vaccinate right now. And there was a clear divide between Latvian-speaking inhabitants of Latvia and Russian-speaking inhabitants of Latvia. 58% of the first group is ready, while only 37% of the second group is ready. So it's not quite clear why it's the case. It could be due to influence of Russian state media saying that Pfizer and other Western European vaccines are no good. Could be a lack of communication on the part of Latvian government, as the Latvian language is the only state language in the country. Most communication goes from Latvian language. Maybe that's it's not good for Russian speaking, so to say. It's hard to say. So what is the vaccination plan? The goal is to reach the 100,000 shots per week, but it probably will it's possible only from April onwards. And the idea is to get 70% of total population vaccinated by the end of August. And to remind, vaccination is voluntarily in Latvia. So the order and timing, there are 8 stages, 8 groups of vaccinated. First group is medical staff, 36,000, and essentially I would say that most of them are already vaccinated. So you can see on the graph, so around 20,000 people are vaccinated. Essentially all of them are medical staff or pharmacists and so on. Those who are willing to get a vaccine and who are able to vaccinate, because many medical staff are actually at the moment are infected, so they cannot get a vaccine now. Today started the social care center vaccination, and just half an hour ago, I read the news that our prime minister and our president got vaccinated in front of the TV cameras. So it's a kind of a PR campaign to promote vaccination. The next stage would be probably in March for 70 plus people, and of those with chronic diseases, and then from 60 to 70 year old. And the second quarter of the year will turn to educational workers in educational institutions, then operative services staff, so police and firefighters, also army and energy workers, and then we'll go to special facilities like prisons and shelters. And on the third quarter, it will be critical workers, religious organizations, other critical workers in other organizations, such as workers in the shop, for example, and only then everyone else. So registration has started essentially just a week ago. There's a web page where you can register yourself. I did it, but personally, I don't see myself getting vaccinated. Well, I'm not part of educational institutions, so it probably will be somewhere in August or September, maybe. So the main challenges are delays of vaccine shipments, and that's also due to the error of purchase orders. So unfortunately, what happened is that the Ministry of Health has wrongly declined initial Pfizer offer in November. So we had an opportunity to buy quite a lot of Pfizer, we declined that. And the idea, well, it's clearly wrong, and it's admitted at the moment that it was a mistake. But the reasoning behind was that the Pfizer vaccine is hard to handle. It needs to be stored in an extremely low temperature. And so at that time, Ministry of Health thought that AstraZeneca would be just easier to handle. Well, with the hindsight, it's a mistake. So we're now waiting for the vaccine, and that's one of the reasons why Latvia is lagging behind other European countries, as Torbjörn showed in the very first slides. So the other issue would be the lack of trust in vaccine and politicians among people as well. And probably logistics is the third challenge. So let me finish here, and that's end of state reports. Thank you.
Thank you, Sergej, and everyone else presenting the country experiences with vaccination. Maybe we can actually turn off the slide and get all of the panelists back on the screen. Thank you. So I'm going to, as we said initially, Q&A session. You can type in your question in the Q&A feature, or you can raise your hand if you prefer to speak and ask your question yourself. Otherwise, I'll read out the Q&A questions that come up. I wanted to, since I'm privileged enough to sit here, to start with some questions to our panel, and please feel free to answer the things that you think are relevant. But I mean, if we just compare across our region now, what do you think? What is your best guess will be sort of the political aftermath in your country from how they are currently handling the vaccination efforts? And the second big question, I think, which is on the mind of a lot of economists, is how is this going to affect your vaccination plans? How are they going to affect how the economy is going to develop during this year and next, maybe? Because of course, a lot of the forecasters internationally are making revisions upwards for this year already, based on sort of thinking that we will be vaccinated, and from your perspective, are these realistic sort of positive updates of the forecast, or do we still have reason to think that you will be running economies in lockdown mode, etc.? So who wants to go first? Two questions to start.
I can talk about the first question. Yes, Belarus is already living inside of political aftermath of the lack of government's response to coronavirus. Many experts, many political experts say that important part of the reasons of unpopularity of Alexander Lukashenko was his lack of reaction, and in the beginning he was even ridiculing people who were dying from COVID. And this discrepancy between what people observe around themselves and official data, official reaction. So yeah, it looks like it played an important role. With regard to economy, well, hard to say. If we talk about Belarus, right now, political crisis that we're having is affecting, it has much bigger effect on the economy than COVID. With respect to COVID, economically, we did pretty well, so there was no lockdown. Factories were producing. Of course, some sectors, especially hospitality sectors, were down. The other question is that we are a small and open economy, so it's not enough that we don't have a lockdown. It is important how our trade partners behave. And if everybody else will have lockdown, then we cannot import and export stuff. So in this dimension, economy very much depends on how COVID will evolve and in other countries.
Thank you. Anyone else wants to chip in?
If I may add, go ahead.
Yeah, I mean, I would say that, in Georgia, it's a political pluralism, or sometimes one would say antagonism, that raises the stakes for the government to get it right. Because there is, currently we have Roine political issues. Of course, the criticism of the government is high and different from the opposition side, but that means that at least the vaccination effort, they want to make sure that whatever depends on them is done right. And it seems that the main concern would be the shipments and the availability of the vaccine. There is a big pressure to open up the economy because people are really at the end of the rope as far as the economic situation is concerned. Consumer confidence went down again in November and December. There is big fear that if something doesn't change soon, in the summer at least, there will be a big economic crisis.
Pavlo.
Thank you. I think that probably this saying that in COVID pandemic, no one is safe until everyone is safe. I think this is very much valid for the situation with vaccination in Europe, where you can see the very clear borderline between the EU countries and non-EU countries, which are still on the same continent and within the same, cultural and economic and political space. And this borderline is very, very clear. And we don't only speaking about, for example, Ukraine or Moldova or Georgia or Belarus, but take Balkan countries, which are in the geographical middle of the Europe, and Serbia and Albania. They are kind of struggling to get any vaccine right now. And that can lead to the situation that, say, in summer, when most of the EU countries will reach the inoculation rate, which will allow to get the effect of declining the transmission just because of this factor, our countries will be still sitting in lockdowns and, striving to get our vaccination campaign started. And that may lead to the pretty tough economic consequences and also political consequences, because there is also some geopolitics here. I think Chinese or Russians are very much eager to influence our countries with their vaccination shipments. So this what really worries me, and I'm happy that there are some 13 countries in Europe who made an appeal to the European Commission to make EU and non-EU European countries get through this vaccination campaign in one boat. I think this is very, very important thing to do.
Thank you. Any other thoughts on politics and economics in your countries?
Well, if I may add a few things, we will have national elections next year, and what I see already now that the rise of populism, it's obvious that there will have it's highly likely, let's say, that there will be some political parties that are we didn't have before, exactly because of the COVID situation in Latvia. So that's something to expect. Yes, thank you.
Michal?
So in Poland, there's, as many of you will know, there's a number of political challenges going and happening in parallel with very strong street protests against recent developments concerning the abortion rights. There's also an attempt by the government to limit free media, which ended with a big coordinated initiative by private media yesterday, basically to shut down the access to TV, radio, and online information from private sources. I think that on top of that, if we only focus on the vaccines, this will be a less important factor from the point of view of political developments. On the one hand, because the distribution has so far been quite well prepared and rolled out, and on the other hand, the reason is that any shortages or problems can so far be blamed on the European Union, and that seems to be playing in the hand of the current government as well. So I don't expect the vaccination program on its own to be a major issue, but there's many others that will affect the economic and political life in Poland in the next months.
All right. Unless someone else wants to say something, we have a couple of
Can I add a short note?
Yes, of course. Yeah.
Well, about economics, post-COVID economics, I think that another thing that maybe not many people are thinking about is financial bubble, which is now being created partly due to several response policies which were created to solve to fix COVID problems. And if and when this financial bubble will burst, this will also have potential large economic effects, especially as it always happens on developing countries.
Thank you. Yeah, I think everyone who likes to be active in financial markets, they need to really think about what you just mentioned. It's very easy, I think, to get excited with all of the government support programs that pours in billions or trillions of dollars into financial markets. This certainly creates some problems understanding what the real values are in the markets. All right, let me just go to the two questions. I'm going to read up from Maria at site. She says that it seems obvious to me that the first best strategy to reduce death rates would be to give absolute priority to the elderly, given how deaths have been distributed. Apart from Sweden, though, and even there only in theory, all countries seem to be choosing otherwise. Do you have a sense that there is a political economy reason behind that? In particular, some attempt to compensate health workers who were required to big sacrifice during the first wave. It's cheaper to take vaccines from those with more needs and less voice than to compensate them with pay raises. So, any thoughts about sort of what the priorities for vaccination looks like? And I'll read you first the second question here for Natalya in particular, which is about the capacity in Russia to produce the Sputnik V vaccine, and how much do you think would be available for exports, and when and at what cost? So two different questions, but let's start with the first one. How do you think of the underlying reasons for the priority orders in your countries when it comes to vaccination?
Yeah, I can go. Yeah, I would say that I not totally agree with Maria on the issue of old elderly people. So, but I refer only to Russian experience. So Russia first limited in December, when it started on December 5th, vaccination. It limited professional groups and age below 60, because there was no yet information on the safety of the vaccine for the elderly people. Because they joined elder people, they joined the testing later than other groups. So when the results on the safety of vaccine was demonstrated to elder people, they were joined to this vaccination. It's in January 18, and I would say that there are some incentives put, special incentives put for elder people to vaccinate. For example, the measure toward older people to stay safe, to stay at home, that was introduced by Moscow city government in spring, was to lock their free transportation cards that they can use in public transport. All the people above pensioners in Moscow, they use public transportation free of charge using their social cards, specifically issued. So they were blocked. So that was accompanying the measure for their complete lockdowns for these people, like total quarantine. So now there is still recommendation for non-vaccinated older people to stay at home, and their transportation cards are still blocked, but they are freed after people get 2 vaccines. So 2 shots of vaccines. So that's how they put this incentive for all the people to be vaccinated. So I would say that the current situation is there is because there is no limit on the amount of vaccine, so there is special efforts put to ensure that these people are vaccinated. So it's in terms of facilities, of course. So because it's the whole management of the production of the vaccine is done by this Russian Fund of Direct Investment. So it's they from the very beginning, it was clear that the domestic facilities will not be enough to ensure the amount of production. So they are looking in the other countries for the production facilities. So as far as I know, there is already several countries that are producing Russian vaccines, Sputnik V. So, but still the efforts go further. As far as I know, some amount of Sputnik V is distributed in a few countries, but from the very start, the idea was that first it will be available in Russia and then it is exported. The exporting started, but in very small amounts. And as far as I know, like now 50, around 20 countries already licensed a vaccine, and 50 more applied for vaccines. So the developing countries mostly in Africa, in Asia, and Latin America. Yeah, but still, so there is some negotiations with. So there was application in the European Union, but it's still not cleared. So the situation will develop, I think, soon, and based on the development, there will be. But so the Russian own facilities and capacity till June, till summer will work mostly for Russian population. Then it will be more available. And in terms of cost, as for the numbers, that was cost of production is less than 20 euros for 2 shots. So it's less than $10, less than $10 for 1 shot. So it's and the temperature regime is like it's normal. It's minus, but so in different so it is frozen when it is brought to facilities, but it's not less than 15 degrees of Celsius requirements, even less probably, but it is -8. So it's safe. Yeah.
All right. Anyone else wants to say something about the priority orders in your country?
I would say that well, there is a sense in that idea, but it's not like super trivial, especially maybe in our part of the world. So the thing is that health risks for elderly are, of course, much higher. But well, I would speak about like Belarus. Social activity and mobility of elderly people, especially if we're talking about the core risk group, people above 70 years old, is much less than mobility and social activity of people, say, I don't know, 30 to 70 years old. So yes, there are pros, but there are also cons, in a sense that maybe it would be more effective to give vaccines to people who interact with most people, and also interact with elderly people, so medical professionals.
It could be also a strategy to get a trust in the vaccine. I don't know if that's what actually governments thought of, but really, if medical personnel takes the vaccine first, that would be, and you know, there are no major issues, then other parts of the population will be more willing to accept it. So that could be explanation.
If I may add on
yes.
a couple of words. I think that the major issue is not that much of the prioritization, but of the approach to actually administering vaccines to the priority groups. I mean that currently most of the countries use the queues as a way to do that. So the prioritization means a queue. So you go first, then you go second, you go third, which is perfectly fine in countries like Israel or Sweden, when 80% of the population are only waiting for it to come and are ready to rush to their primary care doctor and get a shot. But looking at the countries which has kind of 50% of readiness of the population to come there, may mean that once you start the campaign, people will just not show up. Especially, for example, elderly in countries like ours, where they have transportation problems and you know, other stuff. So this queuing may add quite a large problem with regard to the speed, which is also crucial. This is why we were thinking in our school about changing that approach from the queuing to the effort. So by opening the vaccination to all the population, but putting more governmental effort to the high-risk population groups, whereas letting all the population to come and vaccinate, given that only kind of 50% are ready to do that. Thanks.
All right. I know also now that we have a question from Giancarlo. Can we allow Gianca's mic to work, please?
No, I was answered. I removed my hand.
Oh, okay.
It
I'm a
was
little
about the
bit slow
capacity
on
of
the
the
hand thing.
vaccine.
Sorry. Okay, can I get back to, I mean, Michal, you mentioned things about media in Poland. I mean, if we think of this issue a little bit more broadly, and you all mentioned very different numbers in terms of who actually wants to take the vaccine. I mean, what do you think are sort of the main factors that we see these massive differences? Is it the lack of trust of government, the poor job by the media? So basically, what underlies the big differences we see from Sweden with 80% down to maybe, I don't remember now, Sergej, 20% among Russian speakers in 25, yeah, anyway. So would you like to comment a little bit about what you think are sort of the more fundamental reasons for this? Is it also connected to the popularity of sort of old media versus new media? Sorry, yes, Lev.
Yeah, I would again say, so yes, a lack of trust to government or to authorities in general. When people see that, I don't know, say government lies to you about one thing, you start to think that they lie about something else when they promote vaccines. And another thing is the lack of, well, I would again, like lack of work of media. So when there were all these conspiracy theories, I think there was pretty small reaction on them, and that reaction was like just laugh. People were saying, well, nobody would believe in this 5G things, so we don't need to put I know, big hour-long movie that this is all conspiracy theories and this is not true, and 5Gs don't kill you and you should get vaccinated. So maybe the media was not taking it too serious. And here we are.
Any other thoughts on this?
Well,
Michal?
my guess would be that when people answer that question, it's still in the unknown, so to say. My hope is that when the vaccination process will start, and it will just, people will see that it's not so dangerous as they perceived it somewhere in December or November, and then this vaccination acceptance rate will just naturally increase over time. Because it's also could be that people are, well, they're fed up with the whole situation, also economic side of it. And then when you are ask them that question, and that they're just feeling contrarian, and they say no, to hell with the vaccine. Well, in reality, it might be quite different. So let's wait until the more vaccine is available, actually, to check what are the actual people reaction is as compared to stated. Thank you.
Michal and then Natasha, please.
So in Poland, the rate of positive answers with respect to the prospect of vaccination may seem low. It's only about 50%. But generally, we have to remember that in Poland, the attitude towards vaccines, these sort of common vaccines for adults, like flu vaccine, has never been very enthusiastic, and the rate of flu vaccination in Poland is extremely low generally, and usually only people aged over 70 or 80 volunteer to get the flu vaccine in a regular year. So I think actually the 50% that we see in Poland, although lower than in many other countries, is still not so bad. We have to remember also that was the survey conducted in December. So the acceptance of the vaccine might grow over time, and in my view will grow as there's more evidence that it is safe and that it is working. Additionally, I think that for the moment, this acceptance of vaccine or willingness to take it is not the limiting factor in the vaccination process. And from what we've seen in terms of the numbers of doses available, it will take some time before this factor will limit the scope of vaccination on a population level.
Thank you, Natalya.
Because so I would say that in the situation in Russia is that if we look at the Gallup survey in 47 countries about willingness of population to be vaccinated, Russia is below average. So it's the overall attitude of the population is not pro-vaccination, but different. There are many surveys I saw recently on this issue, and the problem is very few of them are representative. So it's hardly believe, but in some of the survey actually was indicating like in social networks. So there was like 14% of people that were still believing in 5G chips and everything that will be injected with vaccine. So there is various beliefs and conspiracy theories. What I want to say is that because I myself and went through this situation over a few months and with few friends and relatives, what I see that there is a very strong numerical externality from vaccination, because people who went through vaccination, they start talking about it, and it's very popular. Social networks play an enormous role here, because that's how information spread, that many of your close circle is already vaccinated, and it increases the willingness to vaccinate. It's fights this ignorance and other things. So I think that when vaccine is available, the information spread about vaccination, an example of people being vaccinated, it's actually brings start playing important role, and that's what we also observe in Russia, that attitudes of people change within months very strongly toward vaccination.
All right, I think we're getting very close to the end here, so I feel a little bit tempted to end on a positive note, suggesting that social media here will play the important role of spreading a positive image of how important it is to vaccinate, and that for most people it comes with very limited side effects. I'm just going to ask the panel if it's something on your mind that you would like to bring up at this stage. If not, I'm hoping that next time we talk about vaccination, it's basically about the success of the vaccination in our countries, so that we can actually hold the next topic. Next seminar is a seminar and not the webinar. But again, given what you have just described, I'm afraid that we will have plenty of webinars before we actually have reached that point. But again, vaccination will be extremely important for all of us, and to bring back normality in our countries. And I would like to very much thank all of our panelists, and of course all of you listening in on this. And I hope we'll continue this discussion in many different formats going forward. So with that, thank you so much for today, and stay tuned. Bye.